This is Jason Carl. He lifted up a 2x4 and suffered severe low back pain along with an acute spinal deformity or acute scoliosis, or you can call it a lateral shift. Jason has had intermittent back pain since injuring his back in a motor vehicle accident in 2005. You'll notice here a picture of Jason with the lateral shift on day 2 of treatment. We were unable to take a picture of Jason on day 1 because we simply did not have a camera. However, his acute lateral shift was much more significant than you see here right now. Jason is unable to bend forward or backward to any appreciable degree because of severe low back pain and obstruction of movement. The first approach in treating a patient of this type is to correct the lateral shift. Moving the patient in the sagittal plane could result in deleterious effects. One could end up harming the patient. Anecdotally, over the years, I have seen a few post-manipulative injuries when trying to provide manipulation to a patient with this type of a condition. Do not allow manipulative procedures to be applied in this circumstance. The next procedure I am demonstrating is the manual shift correction technique to correct the patient's posture. The objective is to correct the lateral shift and gradually restore lumbar extension range of motion. This is a self-shift using a wall, or called wall shifts. Theoretically, you are affecting the hydrodynamics of the intradiscal fluid and reducing the obstruction to movement. Here we are working on prone lumbar extension in accord with the patient's indicated level of tolerance. Once obtaining the optimum lumbar extension position, spinal traction, aka spinal decompression, was added. This is a standing, weight-bearing lateral shift correction technique using the ATM2. We also add standing lumbar extension in this position for this particular patient. During treatment day 3, we fully restored extension range of motion. This is actually day 2, and the patient's demonstrating an overcorrection technique. And here is the end of treatment on day 2, which shows a minimal residual shift. This is day 3, and there is no shift at all. Here's another picture of the patient without any shift. Here's before on day 2 prior to treatment. You'll notice we did not have images from day 1 as we did not have a camera, so you can imagine how much more pronounced the shift was. This is day 2 post-treatment with still a slight residual shift, and this here shows no more shift. Day 3. Shift, slight shift, no shift. Side-lying shift correction procedure. The patient might be more comfortable with a pillow under his head.